All right. Kinesiology 1, we're using the Trail Guide to the Body book. Chapter 2, shoulder and arm. We're going to do this in 2 parts. So we're going to do part 1, and then the next video will be part 2. So just by looking at the body, you're going to have to start being able to recognize um, certain parts of the body on different views, anterior, posterior, the side view. So just a little refresher here. When you're looking at somebody, this big muscle up here is going to be called the trapezius. We're going to get to know more about the bones. So we're going to talk about the clavicle, the acromion. The big muscle in your chest is your pec major. Your shoulder pad muscle would be your deltoid, and your biceps brachii is the main muscle in your arm that you think of when you flex your elbow. All right, so we're looking at the anterior or the lateral view. So this is half front, half side view. There's some muscles you're going to want to get familiar with. So the back of the arm, we're looking at the triceps brachii. This is more of the lateral side of the deltoid. We're going to refer to the armpit area as axilla. You have your swimmer's muscle. They call that the lats or latissimus dorsi. That kind of connects on the side. It's the main back muscle here. And then these tiny little fingerling looking muscles here, these are your serratus anterior muscle. Alrighty. Posterior view. So the base of your skull, you'll hear me often talk about the back of the skull as the occiput. So there's a little notch on the top here called the superior neutral line of the occiput. So that line here, a lot of muscles in the neck will connect to the occipital region here at the base of the skull. So you'll need to know that area for anything neck and head related. Again, here's the posterior view of the trapezius. We're going to go into detail about the scapula. So I'll show you what the spine of the scapula is, and all the angles of the scapula. From the back view, here's your triceps brachii. Brachii always means upper arm. So if there is a word that has the phrase brachii, we're always going to be talking about the upper arm on the human body. The lats, you saw that side view. Here's kind of the back view of the lats, all right? And then as we learn about muscles that might pull on the spine, we'll learn about the structure of the spine. All right, there's some basic bones of the shoulder and arm that you need to know so that you can understand movement and how the muscles will be moving these bones. And then there's joints where these bones articulate or connect. So an articulation is when two bone surfaces connect to form a joint. So in this picture, the main bones that we're going to be talking about today are in bold. So your clavicle, which is your collarbone, medical term is clavicle. Your humerus, which is your upper arm bone here. And then your scapula is your shoulder blade. And then a few joints. The joints are kind of over here. So let me skip those for a second and go straight to the sternum. The sternum is that bone between down the middle of your chest. And then you have your ribs that are connecting on the sternum. The ribs are, there to protect all of those vital organs. So let's get to the joints here. So all the joint names are going to tell you exactly which two bones are connecting. So that's really, really helpful in, in the medical world. So when I talk about the sternoclavicular joints, you can call that the SC joint. That is where your sternum and your clavicle connects and articulates right in this section here. That's the SC joint. Right. Next joint here, that's a pretty important joint that you need to know in the upper body, is your AC joint, or the acromioclavicular joint. So that is your acromion, which is this section coming off here on your scapula, and your clavicle. So your AC joint is where your collarbone and this little fingerling looking bone connects. Last is your glenohumeral joints. You can call that the GH joint. That is where the head of your humerus and your glenoid cavity, which is the socket for where the ball and socket of this humerus bone connects to your scapula. So there's going to be a hollow in your actual scapula where this humerus nicely fits. So here's a breakdown of just the scapula, both the front and the back view. So we're looking at anterior and posterior view. Remember, anterior is always front of your body. Posterior is always the back of your body. Just think of a Post-it note getting stuck on your back that says "kick me." So I always thought of that as a reminder of what side is posterior. So if you look at this picture on the left, this is the anterior image of your scapula. So here's that the acromion right here, that little nub where your AC joint is. We're going to have another projection coming off here called the coracoid process. That's really important for muscle attachments. And we'll be learning more about which muscles attach there in the future of this slide presentation. Here's a good picture without the humerus in the way of your glenoid cavity. So here's that ball, or here's the socket to the ball and socket joint. All right, we're talking about the borders of the scapula. So while we're on this page, I'm going to jump over to this part of the view. So we're looking at the back. So if I were looking at someone's back and we stripped away all the skin and the muscles, this is what we're looking at here. So the big one here is your spine of the scapula. So your spine of the scapula is going to be this projection, this raised bone that goes across that upper part of the scapula, and it will actually divide a couple muscles of the rotator cuff here. So so you have your spine and the scapula, and then we're talking about the angles. Your superior angle is going to be on the top here. Just think it's, oops, here we go. I'm just messing things up. Hold on a second. All right, we're back at it. Okay, so your superior angle is always going to be above something that would be inferior, which is below. So superior angle is this little angle at the very top. And if I were to say your inferior angle, I'm talking about that bottom little angle of your scapula or shoulder blade. Now we're going to talk about some borders. We have something called the medial border. So this section here is going to be a lot closer to the other side of your scapula, to the center line. So the center line of your body, we'll just pretend, is your actual spine. So the medial border is on that end, and the side further from your spine, closer to your armpit, is going to be the lateral border. All right, some bony landmarks of the shoulder and arm that we're going to talk about today specifically. There's only a few right now that I want you to know until we get into the lower arm. So let's see here. We need to know about the greater and the lesser tubercles. And also there's a little notch down here called the deltoid tuberosity. So these landmarks on the humerus are really important because some major muscles connect to these bony landmarks. All right, where am I at? So also here on this right side, this is the posterior view. That's the head of the humerus. This is what connects to your scapula at the glenohumeral joint. All right, now we're looking at the clavicle. So not to confuse anybody, here's the superior view over here. Oops, I'm clicking things again. Hold on a second. All right, bony landmarks of the shoulder and arm. Let's talk about the clavicle. So we're looking at the superior view of the right clavicle. So this would be as if I were looking down upon you at the top. This picture here is the inferior view. So that's if I were to be laying on the floor looking up at the bottom part of your clavicle. So that's what that means with the views. All right, so there's two ends of the clavicle. There's the sternal end, which articulates with the sternum here, and the acromial end, which articulates with your acromion process. All right. And then just for fun, if you want to look at some of the grooves and the other bony landmarks on the clavicle, on the bottom of the clavicle here is going to be a little groove. There's a tiny little muscle called the subclavius, and that's kind of where that's hanging out. All right. The other ones aren't as important, but we will learn more about them. All right, in the book, they like to call these bony landmark trails by names. So we're going to kind of see what they're talking about here. So this is the along the edges portion of the trail guide book. If you guys ever need help on what part I'm talking about, at the very bottom of the PowerPoint is going to tell you what pages are associated with the slides. So I put these in a colored order. I know we just talked about the scapula, but I want to kind of just show you these borders in a little easier format. So first, we're going to talk about that inferior angle. So your client's laying down on the massage table, prone. So this inferior angle is going to be that little bottom angle on the scap. And then we're going to bump up to the blue section, which is your superior angle. This magenta color is going to be the medial border of the scapula. I did not color this, but this is the lateral border along here. Last but not least, the spine of the scapula is going to be this little ridge along the upper part of the scapula. All right, the trenches. The trenches that they are talking about is the subscapular fossa. So what that means is there's a picture over here of just the bones. If you were to look at somebody, strip away their rib cage and everything else, and look at them straight on, you are looking at the subscapular fossa. So that is this section here. This will house a muscle called the subscapularis. Here's a little picture of a little traction happening with the shoulder joint so that they can kind of access that lateral border right under it to kind of feel the subscapular fossa or the subscapularis muscle. So that's what's happening here in this picture. All right, the other trenches. So we have subscapular fossa, and then we have these other two fossas. So this is the supraspinatus fossa. at the upper part, right above the spine of the scapula, yes. And then below the spine of the scapula is going to be your infraspinatus fossa. So this is the posterior view, and this is that anterior view that I was talking about. If I were to strip all the muscles, the chest muscles, and the ribs away, you'd be looking straight up at that. All right, the springboard ledge. These are the joints that we're talking about. So joints will have a little bit of give. They're connected with ligaments, so you'll be able to move them a little bit. So I know I went over this, but now we have an actual picture of the AC, the GH, and the SC joint here. So again, here's the abbreviations: acromioclavicular joint, glenohumeral joint, and sternoclavicular joint. So these are all the articulations for that. Now, if you were to palpate somebody's shoulder blade, you can find that spine of the scapula and kind of just keep going along. You'll feel a little divot where the AC joint is, but then you can kind of feel where that connects, all right? So just go ahead and, palpate yourself. It might be easier if you go off the clavicle end to kind of try to find that AC joint, but palpation skills will get easier the more often you do that. Right, we have something called the two hills and a valley. So the first picture shows something called the greater tubercle. That is going to be more, how do I explain this? More posterior to the lesser tubercle. So you have your greater tubercle and your lesser tubercle, and right in the middle between the two is this groove called the intertubercular or tubercular groove. That is where your bicep tendon runs through to connect onto its attachment points. So it's also called the bicipital groove, if that's easier to say than intertubercular. All right. So greater tubercle, lesser tubercle, bicipital groove. All right. So this is the attachment for the long head of the triceps back of the arm. If you were to palpate along the the lateral border of your scapula, where it connects to the humerus, there's a little tiny tubercle called the infraglenoid tubercle. If you break down that word, glenoid, we're just going to take the back. That's the glenoid cavity here, yeah. And then infra is below. Supra is always above. So if you go just below the socket for the ball and socket joints, that's the infraglenoid tubercle. So you can kind of, palpate that yourself too. Now let's talk about muscles. Here's a little fun diagram of a bunch of muscles. You guys can go ahead and try to cover up the words and guess which muscles they are once you learn them. So we're going to be learning the shoulder muscles that move the shoulder and upper arm. All right, I'm not going to go over each muscle that does it right now, but as we learn the muscles, it'll actually go over the actions. So these are the actions of the shoulder joint. So first picture here, the shoulder joint will flex. Now, we're not talking about the elbow. Imagine the elbow doesn't exist. So we're talking about this shoulder joint here, right? So flexion, obviously, is coming up towards the ceiling. So it flexes. We're going to pop over here. It extends, so brings it back. And here's the anterior view of extension. So it's flexed, and if it were to be dropping back down, we're talking about flex or extension. Here's a couple muscles that are involved in those actions. I want you to keep in mind that the deltoid does virtually everything that the shoulder can do, or moves the shoulder in every direction. So the deltoid is a really important muscle for full shoulder movement. Okay, dokie. Let's talk about shoulder horizontal abduction and horizontal adduction. So again, your deltoid is primarily responsible for all of the horizontal ab and adduction. So here's pictures of that. So remember, abduction is going away from the body. Adduction is going to be going back towards the body. You're adding it back towards the body. All right, now we're not talking about the horizontal part. We're just ab and adducting here. So again, you'll notice a lot of times if a muscle is moving up, that muscle, or I'm sorry, if a bone is moving up, that muscle tends to be above it. If it's moving down with gravity, it tends to be below the joint that is moving. Does that make sense? I hope so. So abduction, away from the body, we have a anterior and posterior view of abduction. That is going to be mainly your deltoid and a fun little rotator cuff muscle called the supraspinatus. Now we're going to adduction, so that is bringing it back to the body. You're adding the arm back to the body as a whole. And there's a lot of muscles involved with adduction, and notice that they tend to be below the joint. Yeah, with the exception of the pecs. It is below the joint, but not super below the joint here. All right, shoulder, lateral rotation, and medial rotation. So we're talking about internal and external rotation because, kinesiology likes to have two things mean the same thing. So over here, lateral would be if you're looking at the humerus. If it is externally rotating, it's going lateral away from the body, right? If we are internally rotating, we are medially rotating. So that whole bone is going towards the middle line of the body. Again, Mr. Deltoid doing all the work here. And a bunch of other muscles that are also involved. The pecs actually do quite a lot for movement of the shoulder. So it's actually extremely important when someone's having shoulder dysfunction or mobility issues in the shoulder to work the pecs so that you can kind of try to free that up a little bit. All right, scapula, adduction, and abduction. So we're talking about protraction and retraction. So abducting would be protracting. So if these are your shoulder blades here, if it is abducting, going away from your body, it's kind of just rotating a little bit around the rib cage, we'll say. So that's protracting, abduction. Now, the opposite would be your adduction. So you're bringing the shoulder blades back to the center. You're retracting it back. Does that make sense? All right, so you got a couple muscles in the front that are going to do that abduction, and some muscles in the back that are going to bring it back to center. So I hope that makes sense. I'm going to kind of show you this picture on the right here. Kind of focus on this. So imagine this is his scapula. Well, it is, but underneath all the skin and all the layers of muscle is your scapula. So you have your trapezius muscle, which we'll learn, and something called your rhomboid major and minor. Your rhomboids are a diagonal muscle between your scapula and your spine. So when these contract, it's going to be pulling the scapula back towards the spine. So that's how you are getting your retraction. There's just a little explanation that hopefully makes a little sense. Okay, so we're talking about scapula upward and downward rotation. So first picture, if we're talking about downward rotation, here's your scapula. We're going to talk about it moving this way. All right, just kind of imagine that superior border, all right, moving, right? And downward would be away from the center line. So if we're going this way, it's downward rotation. And here's some muscles involved with that movement of the scapula. All right, let's talk about some muscles in the shoulder, muscle group number 1. So we're talking about deltoid, trapezius, the lats or latissimus dorsi, teres major, not to be confused with minor. So there's a major and a minor, and I'll explain the difference soon. All right, so I'm going to explain what this table means over here. A would mean action. Again, you can find this in the Trail Guide books 67 and 68. Those are the pages for the deltoid. So A is going to be all the actions that the deltoid does. Here, bold in red, see how it does basically everything. And it'll break down which fibers do what. So all fibers, anterior or posterior. O would be your origin. I would be your insertion. So if you hear the word attachment points, we are talking about points on bones where muscles attach. So the muscles will always form a tendon, M, muscle, tendon, MT, just think massage therapist, works on muscles, right? So the muscles form a tendon, and that tendon attaches to bony landmarks, and that is how things move in your body. So we got N also, which is the nerves that innervate that muscle. So we're not going to dive deep into the nerves, but just for your reference, you can kind of see which nerves innervate that muscle. Now, for like future, if you know somebody is having problems with certain vertebrae, maybe they have a herniated or bulging disc or some disc degeneration, it might start affecting the nerves that are directly coming from that specific vertebrae. So if you're having issues with, we'll say, your C5 or C6, your cervical spine 5 or 6, it might ultimately start affecting the function of the muscles that they're innervated by that nerve. Right, and now I'm going to show you a picture over here. Now, if you look at these picture diagrams, it's actually broken down really well. The origin of the attachment point would be what's black, and the insertion would be what is red. So the origin typically is the part that doesn't move. It's the stationary bone. Typically, the insertion is usually the bone that's getting moved to that point. So we'll just pretend that this is a giant, I don't know, this is the dock. Okay, you have a boat that you are docking. You're standing on the dock here, O, origin, and you've got, your rope connecting to your boat. You're trying to pull it in, right? So you're not moving, but you are moving the boat. So as you're pulling that string, and in this case, the string is the muscle fibers, you are bringing that closer to you. So the boat is your insertion. All right. The fibers of the deltoids. So all the fibers will actually abduct the shoulder and bring it away from the body. Now we're talking about these anterior fibers. There's a picture here kind of breaking up each section. Anterior is going to be in the front, yes. Middle fibers are going to be, central on the deltoid, more lateral, I guess I should say. And the posterior fibers are going to be in the back. So these front anterior fibers are going to help flex the shoulder, help medially rotate the shoulder, help horizontally adduct the shoulder. And then we have our posterior fibers that are going to extend the shoulder, laterally rotate the shoulder, and horizontally abduct the shoulder. Your origin. So if you're confused about some of these words, just try to slowly read it and break it down. So origin is lateral 1/3 of clavicle. So we know that this is your clavicle. The lateral side is not center, so over here. 1/3 will be about this section here. So it's, right here on the lateral 1/3 of the clavicle, the acromion, and the spine of the scapula. And it attaches, all the fibers come together. It forms kind of like a little peak here, and attaches on the humerus on a spot. It's roughly about halfway down, maybe a little less, to your deltoid tuberosity. The trapezius is like the main muscle you think of when you're getting a shoulder massage. So the trapezius is actually a very large muscle that has a lot of dysfunction often. But when you think of squeezing this meaty part of somebody, that is the upper fibers and the middle fibers of the trapezius. We also call that the traps for funsies. So in this picture, remember that superior neutral line of the occiput? That's where your trapezius attaches to. So there's multiple sections. These are the upper fibers, which tend to be in your neck. Your middle fibers tend to be around the upper shoulder blade. And then your lower fibers are below the spine of the scapula, running down to the middle lower part of your back. And you can kind of see there's all this connective tissue here. So that all kind of just connects on all the spinous processes all the way from C7 down to T12. So cervical spine 7 down to your thoracic spine, the 12th vertebrae. Anyhow, what the heck does the trapezius do? So you're going to see some words in here called bilateral and unilateral. Bilateral means both sides are working together. Unilateral means one side is doing the work, okay? So bilaterally together, they help to extend the head. So if your head was in a flex position, these are going to contract to bring your head back into neutral or to look up at the ceiling. So that is bilaterally. Now, unilaterally, if only one side is doing it, all right? So that, if that were to contract, you're going to laterally flex the neck. It'll also help rotate the head and neck to the opposite side. I know that's confusing, just something you're going to have to remember. Where am I at? It also, since it connects onto the scapula, will raise it up. It'll elevate it. It'll also upwardly rotate the scapula. And that's all one-sided. If you were to talk about those middle fibers that are, in the shoulder blade area, the upper shoulder blade, those will adduct the scapula. They'll also stabilize it so it doesn't move all around when other actions are being performed by other muscles. Then you have your lower fibers that are going to bring that shoulder blade back down and upwardly rotate the scapula. All right, origins. Go into the picture here. The occipital protuberance, so that, superior neutral line of the occiput is where this originates. And it also originates, again, like I said, C7 to T12 on all those spinous processes. The spinous processes are the spikes coming off your spine, kind of like a dinosaur, if you were to look at your back. The spikes coming off the side, we will talk about those later. Those are the transverse processes. But in this case, let's just talk about those spinous processes, the dinosaur spikes. So you have all that connective tissue kind of straight down the spine from head to T12, and then it kind of runs into a point onto your scapula. So see how it inserts onto that spine of the scapula. So that's what we're looking at. Where are we at? Lateral 1/3 of the clavicle, acromion, and the spine of the scapula. So there's a lot to the trapezius. So it is best to thoroughly work the entire muscle group and all the fibers. The lats, or the latissimus dorsi. This is the main muscle you think of when you're swimming. So it does the swimming actions. It extends the shoulder, so it brings it back like you were doing a stroke. It will adduct the shoulder by, bringing it back to the body, and it'll medially rotate. All right, so the origin. There's a lot of places that this muscle originates. So I'm going to look at the picture of the actual muscle, and you can see this fascia, or this connective tissue. This is called the I can't even say it, thoracolumbar fascia. So what that means, it's on your thorax, and it's part of your lumbar spine. So that's how we, combine the words to get, the thoracolumbar fascia. All right. So, origin, where are we at? Inferior angle of the scapula. Remember that little tiny point on the scapula? So, this is how it can, this is a spot where it's stable, right? And also, where are we at? Spinous process, those last 6 thoracic vertebrae. So we're coming in here, the thoracic vertebrae. It also connects on the last 3 ribs, sometimes 4. It connects on the fascia, that whole fascia line there, and something called the posterior iliac crest. Now, we haven't learned about the iliac crest yet, but that is the top of your hip bone. All right, so we're talking about the posterior, the back part of your hip bone. So you can see here that if you were to have tension in this muscle, it could affect any of the points that it is attached to. And then it kind of goes off into a tiny little point here and inserts onto your intertubercular groove. So that is also your bicipital groove. You can't quite see that from this angle because it's in the front, but on this picture here, you have your greater tubercle, your lesser tubercle, and then that intertubercular, or the bicipital groove right here. Straight down between the two. Teres major. So this is teres major. It is not part of the rotator cuff muscle. So if you have a quiz question and it's asking about rotator cuff muscles, do not put major in the works because it is not part. All right, so the action of the teres major is extension of the shoulder. So it's going to bring the shoulder back after it's in flexion. It also will adduct the shoulder, bring it out, and medially rotate. The origin here is that inferior angle, that tiny little spot on the bottom, and the lower 1/3 of the lateral border. So an inferior angle, 1/3 lower part of lateral border, then it runs, connects onto the crest, which I'll show you what that is, of the lesser tubercle of the humerus. So the crest is going to be kind of a line of bone that kind of is raised a little bit. So you have your lesser tubercle that is going to be in this front section here, and there's going to be a little ridge right under it that this teres major connects to so that it can properly move your humerus. All right, this is the important part, the rotator cuff muscles. We deal with a lot of rotator cuff injuries and post-surgical issues. So we'll deal with helping to, relieve some of maybe the frozen shoulder that could be caused from a rotator cuff repair or injury. And we also help the mobility of post-surgical rotator cuff surgeries. So the rotator cuff muscles are as followed: supraspinatus, infraspinatus, teres minor, and subscapularis. So if you were to look at these three letters in the beginning, it spells the word sits, S-I-T-S, sits. The muscle sits on the scapula. Here's the supraspinatus, right? This bad boy will abduct the shoulder, and the rotator cuff muscles have a name that's very deceiving. They do some rotation on the shoulder joint, but their main job is to stabilize the head of the humerus in the glenoid cavity so that your shoulder does not dislocate. So these four muscles of the rotator cuff are mainly for stabilization of the head of the humerus. So the supraspinatus originates in this groove here, this fossa, I'll call it, the infraspinous fossa. So infraspinous, infraspinatus. It tells you exactly where it hangs out. Then it's going to run under the scapula. So you have, your spine of the scapula, your AC joint. It's going to run under there and connect onto the greater tubercle of your humerus or upper bone. So that's going to be back here. All right. Infra. And here's a cool diagram here that kind of shows you all these rotator cuff muscles on the posterior side and where they attach. So they're going to need spots on the greater tubercle, right, that are near each other to do the actions that they need to do. So your infraspinatus, which is inferior to the supra, right, these will laterally rotate your shoulder, adduct the shoulder, and again, like I said, stabilize that shoulder joint so it doesn't pop out. It originates in the infraspinous fossa of the scapula. Infraspinatus muscle, right? Then it runs and connects again to the greater tubercle. So these three back muscles of your rotator cuff are all going to connect onto the greater tubercle. There's only one that doesn't. Teres minor. So teres minor and the infraspinatus are basically the same thing. Yes, but no. So the teres minor is small, but it will carry out these actions that the infraspinatus muscle will do. It'll laterally rotate, adduct, and stabilize the joint. It's just another helper muscle to that bigger muscle, right? It originates on the upper 2/3 of the lateral border. Break that down. Here's the lateral border. If you look at the upper 2/3, so 1 2/3, yes, and it's going to run across and connect again on the greater tubercle of the humerus. So all these muscles are going to be connected on this side. All on this side, you don't go past the bicipital groove. They're all before that. Before, if you were looking at the back of the body, not to confuse you. All right, the fourth muscle of the rotator cuff is the subscapularis. So this is the muscle that is on the anterior side of the scapula if you were to remove everything and look straight on at somebody's scapula. So this guy is responsible for medially rotating the shoulder and stabilizing that head of the humerus again. It originates in something called the subscapular fossa. Again, the rotator cuff muscles minus the teres minor are all going to have fossa that they are, the names are similar, right? So all those other bad guys on the back connected to the greater tubercle, which is over here on this picture. This guy, this subscap, connects onto the lesser tubercle. He has no friends. He's a lesser type of person, right? And remember, it's divided by the bicipital groove or the intertubercular groove right here. Right. If you were to, put your fingertips around the head of the scapula, this is kind of where those muscles all attach, the head of the humerus. So you have teres minor, infraspinatus, supraspinatus, and then bicipital groove here, and then you have that lesser tubercle over here. In the next video, we're going to be going over part 2 of the shoulder and arm.